the first session was about fibromyalgia, something that we all struggle with. So there was very, very lively debate and lots of Twitter traffic about fibromyalgia, the management of it, the diagnosis of it, and how it affects patients coming through anesthesia and surgery, and particularly how they present with acute pain.
I think it's a varied program of many different topics, and I think it reflects the nature of pain, how there's both the biomedical but also the psychological and social elements. So I think the program reflects that, so I'm looking forward to that.
This has been the Faculty of Pain Refresher Day, and it has had two very well crafted sessions. The first one was on fibromyalgia with people from 3 different fields, 3 different countries, putting it together with some really good insights as to how it applies to acute surgery. For me anyway, I think everyone took out different things.
Well, I've just arrived this morning from a 12-hour flight from New Zealand, and so I'll go straight to the meeting here off the plane. So I'm a little bit tired.
Fair enough. So how are you finding it so far?
Oh, good, yes. The first session on fibromyalgia, it's a very controversial subject, and it's, the way that people's view it has changed over the years, and yes, it's interesting, and it's still a lot of controversy about it all.
I particularly liked this, the program today, because they're looking at the interface between the different disciplines in pain medicine. So this afternoon there's a lot of mental health, addiction, medicine, and things that are a bit sort of separate from basic biological pain interventions.
It's my first ANZCA meeting. I'm a psychiatrist from Perth and I work in chronic pain. So it's been really interesting to see the kind of topics being discussed today. I also thought it was really helpful for me to understand a bit about neuromodulation, because it's something I see my patients having done, but I have very little knowledge of the science behind it. So it's quite useful to come to a meeting like this, I think, and I'm looking forward to the next bit.
Well, at this stage, I'm mainly into the chronic back problems. Some anaesthesia in that area. I'm actually in my retirement stage. I'm 77 years of age and been in practice now for probably 50 years. And so I just focus now on mainly chronic pain and spinal pain.
So the updates in neuromodulation, which is the next session that we're going into, will be very, very interesting. Neuromodulation is going through a revolution at the moment, with a lot of more modalities coming through, a lot more pain conditions being treatable. So I think it's quite an interesting and exciting space. Later on in the week we have the Michael Cousins lecture, and our American visitor is going to be speaking about marijuana and the place, if it occupies any, in the management of pain or indeed any conditions. So we're looking forward to that.
I've got 2 workshops tomorrow where I'm facilitating, and that's a new workshop that we're introducing to the College of Anaesthetists and Pain Medicine Specialists, and it's on acute severe behavioural disturbance. So it's exciting because it's sort of a world first, so it'll be interesting to see how that goes.
I'm looking forward to seeing the balance study presented. I think that'll be a real highlight. And I think as much as anything with these, it's interesting to see what different people are doing. I often get some real surprises. Some of the things I was least expecting to be helpful, I get the most out of, and vice versa too.